Well, much like the province, Cynthia, Toronto seems to be at a crossroads when it comes to dealing with COVID-19 and complying with some of the measures that have put in place for everyone's safety. It's either do as we're being told or this thing is going to go on and on. And that's why the city seems to be stepping it up yet another notch. Enforcement involving park staff with the help of police are now patrolling these public spaces. Charges have been laid. City staff have been responding to 197 complaints and have now doled out 19 notices so far, where signs and caution tape have been ripped down. They're being put back up, along with locks and electronic signs with warnings. All that, and officials have the ability to issue more orders if they see fit.
To make sure people get the message, parks crews were out today blitzing hotspots with Toronto Police and bylaw officers. Parking lots are being closed off where they can be. And while we always try to persuade and educate people, as we've been trying to do from the beginning, I'm afraid the time is up for those who don't want to listen or who don't care. And for them, we won't hesitate to issue a minimum $750 fine and potentially as high as $5,000 fines so that they maybe will get the message.
Also today, a number of staff from Toronto Public Health's Victoria Street building have now tested positive for COVID-19. That includes at least one person working at the safe injection site on the ground floor of that space. As a result, staff in that building were asked to self-isolate and work from home today.
Since COVID-19 is not spread through the air, a building is not considered at risk simply because there has been a case or cases in a building. It is in fact those that have had close and prolonged contact with a COVID-19 positive case that are considered to be at risk. We've conducted enhanced cleaning of the office in order to protect our staff as well.
Now, coming up later in the show, we're actually going to start looking closer at GTHA numbers. We're going to show you the number of cases in different parts of the regions, and we're also going to tell you about some of the measures that are taking place in those areas as well. Throughout this COVID crisis, we've made a point of breaking down the numbers for Toronto and Ontario and filling you in on what's happening on a provincial and municipal level. But an important part of this story is what's happening in the GTHA as a whole. And so we want to share some of those numbers for you right now. Let's start with the Toronto numbers first. Today, we found out that there are 591 confirmed cases of COVID-19. 67 of these people are hospitalized, 30 are in ICU. There's also been 6 deaths, and 30 people have recovered from their illness. Now, let's look at some of the other municipalities and regions around Toronto. Hamilton has 91 confirmed cases. Halton has 36 reported. There are 216 in Peel region. That includes 125 in Mississauga. York region has 212 cases, including 83 from Vaughan and 92 in Durham region. Now, some frontline healthcare workers at Markham Stouffville Hospital took to social media this weekend, posting pictures in full hospital wear. They're holding up signs to remind everyone to stay home during this time and to continue practice social distancing. Many of the GTA municipalities have implemented measures similar to Toronto's with closures of businesses and public buildings and parks. And Markham's Frank Scarpiti joined Breakfast Television this morning with his own message.
We've done our utmost to get the messaging across for people to stay indoors, to not go on the playground equipment. We're one of the first municipalities to put up warning signs. It is tough to police, to be at every playground and have resources being used to tell parents, unbelievably so, to keep their kids off the playground equipment.
Now, according to the province, the GTA actually makes up more than 60% of the cases in the province. You add up all of those regions, it comes to more than 600 cases in addition to Toronto's 591.